cannot participate in a government-run healthcare program because I took a sacred oath to do no harm. Thank you.
I was just informed that we have people lined up all the way back to at least 8th Street on Pennsylvania Avenue. You guys are absolutely incredible. Do you think Congress can hear us now? Come on, I couldn't hear you. There's no way they can hear you. Can you hear us now? Next, we have Dawn DeBoer from California. She's a constitutional lawyer and a Harvard grad. Thank you, Jenny Beth Martin. I come before you today with no ego-driven purpose. We are gathered together because our nation is being tested. Our legislators have failed us. Yes, but we all know that the ultimate responsibility rests with us, the people. Pravda newspaper in Moscow recently stated that they do not understand how the United States of America can turn towards Marxism and socialism because when they had that happen in their country, they had a revolution. Yes! But in this country, they said all they heard was a whimper. But we know that's not true. Let's hear it! Let's hear it! Yes! Times are tough. Times are tough. But we know that we are in a period of contraction. We need to re-establish a new manufacturing base in the United States if we're going to have any real job growth. We need an e-learning initiative to create an opportunity so that our young people and the people far away can be educated and compete in the skill wars internationally. Yes! And the 13th Amendment to the Constitution of the United States says in pertinent part, neither slavery nor involuntary servitude shall exist in the U.S. or in any place subject to their jurisdiction. Now how are we going to bear the burden with all these taxes? Isn't that involuntary servitude? Yes! Yes! The time has come for us not to abandon our great principles now that we have a huge test upon our nation. Yes, they say, we need to change things. We are broke. We are humbled. We are in trouble. We have all of this going on and we have no solutions. I disagree. Yes, identification is not justification. Yes, we need to stand up as a nation and uphold the principles of freedom, liberty, and justice for all our people without becoming slaves to everyone else. Yes. So I say now, all of you, together, let's let our voices be heard and let freedom ring out. Yes. Freedom. USA. Liberty and justice for all.
you. But before we talk, I want to bring somebody up and acknowledge Ms. Jennifer Halsey from the Tea Party Patriots, who organized the doctors' rally this week on Thursday. On September the 10th, physicians from all 50 states came to Washington, D.C. to tell America that they care about their patients, and it's not about the government, it's about taking care of people and taking care of medicine. You just stay right up here with me. I want to tell you something, that doctors are here to tell you that we're trying to help you, but we need your help too. Now the AMA doesn't want you to know that. The AMA, if you listen to the AMA, they tell you that doctors are behind this, they've endorsed it. But you know what the AMA is doing? They're trying to protect their monopoly, multi-million-dollar monopoly on their government contract to do the codes that doctors have to use. You think they paid for that seat at the table for a reason? Now the politicians, we need to tell the politicians, we don't need healthcare reform, we need government reform. You know, doctors take an oath, and you heard Dr. Scott talk about it a minute ago. Doctors take an oath to do no harm. How about we try to get politicians to take that same oath? Let me tell you something, it's government that gets in the way of medicine right now. Let me give you a couple examples. Did you know that it's actually illegal for a doctor to treat a Medicare patient for free? You didn't know that, did you? So let me tell you something. That means that even if Nancy Pelosi weren't already getting free medical care at your expense, she'd be getting it through Medicare at your expense. Doctors spend 1/4 of their time on Medicare compliance alone. That's jumping through regulatory hoops instead of taking care of patients. They also have to provide, get this one, they have to provide, arrange for, and pay for translators when a patient comes in that doesn't speak English. Tell Congress, you know what we need to do? We need to take back medicine. Tell Congress to get out of the examining room and what? Take back what? Medicine! What's it? Tell politicians that we want doctors deciding how to treat us, not government bureaucrats who decide the most cost-efficient way, so that we can what? Medicine! And we want to tell Congress that we need to kill this